What is migraine? What are the basic treatment lines known for its cure? We gonna know all in 2 episodes coming up. Welcome all to his Pharmacology Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Many ailments like anxiety, nausea, depression, gastrointestinal upset disorders, migraine, etc. find their remedies in the drugs modulating the serotonin, that is 5-HT signaling. For example, 5-HT has an important role to play in the pathogenesis of migraine. Therefore, 5-HT receptor agonists, they are the mainstay for acute migraine attacks. Recently, calcitonin gene-related peptide, that is capital CGRP, antagonists have also made quite effective stay in the migraine therapy. Aura association with migraine plays an effective point in deciding the inclusion or the exclusion of serotonergic drugs. It also determines the severity and the duration of headaches, and no doubtedly the interplay of genetic and environmental factors play an influential role in this regard. In this context, now let's next talk about triptans. Triptans are the drugs. They are the indole derivatives. They play an important role in reducing the nausea and the vomiting of the migraine. The drugs, they are namely rizatriptan, naratriptan, frovatriptan, almotriptan, elatriptan, sumatriptan, zolmitriptan, and for your kind information, a popular fixed-dose combination drug of sumatriptan and naproxen, which is a non-steroidal anti-inflammatory drug, is marketed quite frequently nowadays. Now, triptans, they find their utility in migraine therapy only, not in the prophylaxis of migraine. Oral triptans, they should be given to the patients as soon as one experiences the migraine headache. Now it is the right time to understand all about migraine. What is migraine? It's a specific neurological state. The type includes with and without aura. Without aura is a very common condition, while the one with aura is further classified into different types like typical aura, prolonged aura, without headache, and migraine with acute onset of aura. Aura can begin 24 hours before the migraine headache starts. Some conditions may be experienced along with hyperacusis, photophobia, diarrhea, polyuria, mood alterations, diet changes, etc. Pain of migraine headache can be a few hours, and the role of serotonin, that is 5-HT, is very predominant. This has been proved by various observations and theories like: first, in different phases of migraine, the 5-HT concentration varies in plasma and platelets. Urinary 5-HT concentration is raised during the migraine attacks. If few agents are taken which trigger the release of 5-HT from the stores, then migraine attack is precipitated. With all these evidences, 5-HT agonists, they are quite Widespread treatment modalities of acute migraine attacks. Triptans mainly act on 5-HT1 receptors, and that also specifically 5-HT1B or 5-HT1D receptors. Along with triptans, low levels of calcitonin gene-related peptide, that is capital CGRP, a potent vasodilatory, pro-inflammatory neuropeptide, they were also observed. Their low levels were observed along with the triptans. So, now what do we conclude from this observation? The CGRP antagonistic drugs, they have also a very key role to play in the migraine treatment. Examples are rimegepant. All the gepant drugs, they belong to this category. And CGRP blocking monoclonal antibodies like erinumab, fremanezumab, and galcanezumab. All these drugs and antibodies, they have an important role to play in the treatment of migraine. With this information, we end the first part of our talk about migraine. In the next episode, we're gonna talk about the triptan clinical applications, their adverse effects, and the ergot migraine therapy. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also subscribe for a free monthly e-newsletter of mine, the Pharmacology Further e-newsletter. It contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, Is Pharmacology Difficult? If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.